How the menstrual cycle works. The pituitary gland releases a follicle-stimulating hormone, FSH, after the monthly menses has stopped. Meanwhile, approximately 1 dozen antral follicles, sacs filled with fluid that surround the egg, begin to grow inside the ovary. At least one egg matures during this time. The pituitary gland releases the follicle and begins to produce estrogen inside the ovary in response to FSH and the luteinizing hormone, LH. The estrogen signals the uterine lining to thicken in preparation for the releasing of the egg. This process is known as the proliferative phase of the uterus. One follicle normally grows more quickly than the others, producing additional estrogen, bringing about a decrease in the level of FSH and causing the smaller follicles to stop growing. This leads the pituitary gland to release a large amount of LH, which makes the egg inside the prevailing follicle mature. Then the follicle bursts, releasing the egg. The egg then enters one of the fallopian tubes. This process is known as ovulation. The mature egg should then join with a sperm, creating an embryo. The embryo will now begin descending through the fallopian tubes toward the uterus, where it will implant itself and develop over the next 9 months. The remaining part of the follicle, known as the corpus luteum, begins producing progesterone. This chemical helps the embryo implant correctly in the lining of the womb so that it can grow. It takes approximately 10 to 14 days for the female body to mature an egg and release it. For most women, ovulation normally occurs between day 10 and day 14 after the beginning of her last period. Understanding the value of consistent ovulation is important in determining why a woman is experiencing difficulty getting pregnant. For example, the woman may not be producing enough progesterone to maintain a pregnancy. When women get their period less than 12 days after ovulation, this is a common sign. Alternatively, she may not be producing eggs often, or at all, if her cycles are long or irregular. For more information about pregnancy, click the link in the description below this video.